Hi, my name is Samantha Sweeney. I'm with the Medical Affairs Department at Otsuka, and I want to thank you for being interested in learning more about bipolar I disorder. And today, this is a brief presentation, and it'll cover mostly about what causes bipolar disorder, what it looks like, how it's diagnosed, and how it's treated. So, if you know someone with bipolar disorder, you may already know that this is a chronic brain disorder that affects a person's mood, energy, and their ability to function. And these mood changes are often referred to as mood episodes. So mood episodes can be categorized into kind of two main separate departments, if you want to call it that. So there are two different types of mood episodes. The first that we'll talk about is on the left-hand side of your slide, and those are called manic episodes. This is when a person is feeling very up, energetic, high energy overall, and just being on top of the world. But there are also less severe versions of manic episodes called hypomanic episodes. Now, if you go to the right-hand side of the slide, these are referring to more depressive episodes, when a person is feeling down, sad, hopeless. And we'll talk more about what these symptoms actually look like on this particular slide. So overall, these mood episodes can affect a person's feelings, their thoughts, behaviors, and physical health. So possible manic symptoms include being excessively cheerful, may have some poor judgment, again, that high extra energy could be there, but it can also affect their physical health, so they're not sleeping as well, and they can be irritable at times. And in terms of possible depressive symptoms, so being on the flip side, they may have some feelings of hopelessness, just be really down, again, sad. They may have difficulty concentrating, and also may feel that they are too tired at times, and also have other physical symptoms kind of different from those manic symptoms, like sleeping too much or eating too much. So there are also two different types of bipolar disorder. The first is referring to the bipolar I disorder, and this is where a person must have at least one manic episode. So if you recall from the previous slide, the manic episodes are those, again, feelings of being very up. Bipolar II disorder, on the other hand, is when a person has at least one hypomanic episode, so again, less severe version of a manic episode, and must have one major depressive episode. Now, diagnosing bipolar disorder is done by a highly trained healthcare professional, and we'll talk more about what that looks like later on. And that particular professional may also diagnose a person with mixed features, and that is when a person may have both manic and depressive symptoms occurring at the same time. So if you yourself or you know someone with a bipolar disorder, you're certainly not alone. At any given year, there's about 5.7 million US adults who are affected, and the lifetime risk of developing bipolar disorder is about 1 in 50. And there is a slight gender difference between men and women. Bipolar I is more common in men, whereas bipolar II is more common in women. Now, keep in mind, though, that diagnosing a person with bipolar disorder is not always an easy task, and it can take a number of different tests, again, that we'll talk about in a little bit. So let's look at what causes bipolar, or what we actually think may cause bipolar disorder. So the bottom line is that we don't truly know, but scientists believe that there are some changes in our brain that are structurally related, as well as changes that occur in the chemistry of the brain. So in terms of the structural changes, for example, someone with bipolar disorder, there might be a region in the brain where that particular area is smaller in size than someone who does not have a bipolar disorder. In terms of the brain chemistry, in our brains, we have brain cells called neurons. And these neurons talk to one another, as you can see on the slide, sort of on the right-hand side, And they talk to each other by using brain chemicals called neurotransmitters. And scientists have found that a person with bipolar disorder has different levels of these particular neurotransmitters that you see here than those without bipolar disorder. And these may result in either manic or depressive symptoms, or switching from a manic episode to a depressive episode. So it's not just the structural as well as the chemical changes that occur in the brain that may be responsible for causing bipolar disorder. There are a number of other factors as well. The first we'll talk about is genetics. There are some identified genes that may predispose someone to develop bipolar disorder. But again, that doesn't mean that person will actually develop bipolar disorder. And we've seen that from identical twin studies, where one twin may have bipolar disorder, but the other twin does not. And remember, identical twins share the exact same genes. Family history is another factor. Now, if you have a relative who's a first-degree relative, so a parent or a sibling, that may predispose someone to developing bipolar disorder as well. But again, it doesn't guarantee that you will actually get or develop bipolar disorder. And then there are environmental changes that may also impact the development. For example, a pregnant woman who undergoes a lot of stress has some severe nutritional issues that can potentially lead to developing bipolar disorder with all these other factors, as well as experiencing stressful events during a person's life, drug abuse, mistreatment in childhood, all of that. And we kind of, again, clump that under environmental factors. Bipolar disorder is diagnosed by a highly trained mental health professional, and he or she may conduct several different tests to diagnose accurately. And it may involve a physical exam coupled with getting a really good medical history, also laboratory tests. And these are all done to ensure that we properly diagnose someone who show the symptoms of bipolar disorder so that we can rule out other medical as well as psychiatric conditions that can look like bipolar but may actually not be. So some of the laboratory tests, for example, include a urine test, and that can be used to rule out substance use disorder. They may also order a complete blood work, and that can be used to rule out infections, which can cause some of these manic symptoms or even depressive symptoms, as well as maybe even a brain scan, and that can be used to rule out tumors that can also mimic symptoms of bipolar disorder. In terms of the rest of the exams, it'll probably involve also having very lengthy discussions or conversations with the person who is exhibiting these symptoms, as well as with their family members or caregivers, to make sure that they get the information that covers what these symptoms look like, what's their severity, how long have they had them for, have they been treated for these symptoms in the past, and what were they treated with? And again, also trying to get information about their family history. So there are multiple options for treatment when it comes to bipolar disorder. And unfortunately, there is no cure currently for bipolar disorder, but there are, again, different modalities. So in terms of medications, you have different options. You have mood stabilizers, antipsychotics, antidepressants, and these may be utilized at different phases of the disorder. And your healthcare provider will make sure they go through all of these with you to ensure that you get the right medication at the right time. In terms of psychotherapy, also, as you can see, there are multiple options available, including cognitive behavioral therapy, interpersonal and social rhythm therapy, as well as family-focused therapy to make sure that your caregivers and the family are engaged and understand what the bipolar disorder is really like and how to manage the symptoms. And electroconvulsive therapy is something that is more reserved for those who do not respond to the other treatments that are available. and that can be used for both mania as well as depressive symptoms. So, to summarize, again, bipolar disorder is a chronic brain disorder that affects a person's mood, energy, and their ability to function day to day. The exact cause is still not known, but we do have a fairly good idea of what leads to potentially bipolar disorder. And in terms of diagnosis, your healthcare provider will go through multiple of tests to make sure that you're accurately diagnosed. And for treatment, as we just saw, that you have different options, including medications and psychotherapy. So I'd like to thank you for being interested in this topic, as well as for paying attention. Take care.